Now I'd like to introduce someone who is pushing back the frontiers on making medicines more widely available to populations around the world. Greg Perry is the Executive Director of the Medicines Patent Pool, has long experience in the pharmaceutical industry, I first met him when he was Director General of the European Generic Medicines Association, which he created. He was also the founder of the international version of that. Welcome, Greg. Please, now you're at the Medicines Patent Pool, just give us a snapshot, first of all. I think most of the people here know pretty well what it is, but give us a snapshot of what the real important things are that made you go and work there rather than in Brussels.
Okay. It's not to do with the food, where Brussels is very good, of course. What I'd like to focus on very quickly, the Medicines Patent Pool was established by the United Nations, and it's essentially funded through an organization which is linked with the World Health Organization. And our objective is to accelerate the speed of new innovations in medicine to developing countries. We have focused primarily on HIV. Our mandate was there, but we have expanded recently to hepatitis C and to TB. And there is a discussion at the moment about expansion into oncology and into dealing with AMR. How do we accelerate this innovation, which is created by the pharmaceutical industry? And in the areas that I'm talking about, of course, particularly HIV and in hepatitis C, we have seen groundbreaking innovation. What we do is we set up a partnership with the IP holders, with the industry. We license in their intellectual property through a concept of patent sharing. And then through that, we develop partnerships with generic manufacturers who are able then to create multiple supplies in developing countries. The geography is agreed with the IP holder. So we can accelerate the speed in which the innovation of treatment is delivered in developing countries. So essentially, generic manufacturers produce under license from the IP holder into an agreed developing country territory. And that's essentially how the model works. We heard, and I think you mentioned this actually, we hear a lot about partnerships and a lot about cooperations, but we need to see it really happen. And I'm very proud to be able to stand here after 3 years and be able to tell you that this model actually works. We have 12 license agreements, we have 7 IP holders who are partners, and we have 14 generic manufacturers in partnership developing these products. So it is a model that works, and because it works, it was decided we would expand this into other treatment areas, and that was hepatitis C, where we have one agreement for a top hepatitis C product, DCV, which is produced by BMS. We have a license of that. We have now agreements with generic companies to produce that. And the other interesting fact is we are actually negotiating agreements with pharmaceutical companies, for example, in phase 3 now. So we have an agreement with Gilead for a breakthrough product in HIV called TAF, which we agreed in phase 3. And with ViiV, we actually made an agreement very quickly after regulatory approval at the EMEA. So what we're doing is we're able, with the cooperation of the industry, to accelerate the process of this innovation to developing countries.
Right, thanks for that. Now, how easy is it to persuade companies to come on board? Because without that, you're nowhere on this. How hard are you having to negotiate?
Well, it's got easier over the time, as I think a sense of trust has been built up between our organization and the pharmaceutical industry. It was mentioned again yesterday, the concept of trust, and we know from the European experience, even in developing a regulatory framework, you have to build up trust. So there's a lot of trust that's been developed between ourselves and the industry and between various stakeholders in the industry. So I think what is important is that this is all done voluntarily. You know, we're not out there demanding in an aggressive way that the industry should be working with us. We sit down with the industry and we work out a package and a platform of ideas, and we move that along. And you'll see that in the last 12 months, we've been able to accelerate the number of license agreements quite rapidly. One of the most interesting, I think, was in South Africa with AbbVie, where we were able to turn around an agreement within 2 months to be able to provide lopinavir ritonavir generically in South Africa.
Okay, and what about something like last week's announcement by GSK that they're going to provide much more access to patents. Is that something that works alongside you? Is it subverting or circumventing what you do? Is it adding to what you do? How does that fit into this game?
I think it definitely adds to what we do. I think the interesting point of the announcement by GSK, it covers a number of things, including patent transparency, agreeing to work through an organization.
Perhaps just
like
tell everyone very briefly the essence of the GSK announcement.
Okay,
for those who are not up to speed on it.
Time flies so quickly. Was it last week or the week before? GSK made an announcement that it wanted to increase its access policy in several ways. One was to provide patent transparency. So the patents that were held by GSK were more easily available and known to the public. That actually statement had already been, a similar statement had already been made by German Merck several months before. There was also, within that, the agreement not to enforce patents in least developed countries, then a commitment to license products to generic partners in lower middle income countries, and then GSK also offered to work with us with their oncology portfolio.
Well, to put it crudely, if every company did that, would you be out of business?
No, I'd have a lot of business.
Good. Okay. So you now can sort of funnel that into what you're doing, and you will facilitate the
Indeed. And I don't want to preempt anything, but you'll hear an announcement within the next 10 days between us and one of our partners, which is a direct result of GSK's announcement.
Remember, you didn't hear it here first.
Yeah, you didn't hear that, yeah. The only thing I'd emphasize also, I mean, the IP issue is one area of the access that we have to deal with. Okay. There are other areas. Regulatory approval is an issue which is very important, particularly in developing countries where there is a lack of regulatory capacity. There's a whole issue of healthcare systems, the whole area of funding. I mean, one of the reasons why the challenge in HIV has been so successful is that a number of things were put in place. First, the industry has produced breakthrough innovation. The model has worked. I'm not here standing saying that the model, it has worked perfectly in the area of HIV. Incredible innovation. Secondly, there's been a commitment by the international community to provide funding for the purchase of those products. So through Global Fund, PEPFAR, etc., the involvement of the US, Europe, and other countries has been critical, ensuring that that innovation has been made available to people in developing countries. The third thing has been the commitment from governments. South African government is a great example. The commitment to set up proper programs, procurement, guidelines, involvement by the governments, the political commitment. And fourth, of course, has been the issue of buy-in by other stakeholders and the fact that everybody is aware of the need.